Hi, I'm Dr. Ford, and I'm going to give you an intense 6-minute brain workout on continuous electronic fetal monitoring. And this is part one of the basics. So the purpose of electronic fetal heart monitoring is to provide information about fetal oxygenation and also to prevent fetal injury from impaired oxygenation. There's two types of monitoring. External monitoring is non-invasive, and it measures both the uterine contractions and also the fetal heart rate. A tocodynamometer is placed on the mother's abdomen, and you place that on the area of the strongest contraction where you feel it the strongest, and then an ultrasound transducer picks up the fetal heart rate. Then internal fetal monitoring means that an intrauterine pressure catheter is inserted into the uterus to monitor contractions, and then a fetal scalp electrode is also inserted through the cervical opening and is placed on the fetus's scalp. So with both external and internal monitoring, the pattern is shown on the computer and it can be printed on special graph paper. Let's look at some of that special graph paper and look at a strip. Okay, so here's an example of how a strip would be printed. The intervals between the vertical red lines, that represents 1 minute. So fetal heart tracing, you can see, is the line on the top in the upper pane, and then uterine activity and contractions will be on the bottom of the screen on that lower pane. So care providers that are certified in fetal monitoring, they'll analyze the patterns, they'll use calculations, based on the baseline heart rate, and then categorize what they see based on those calculations. Now, we're not going to do that. We're just learning the basics. Our objective is simply to recognize some of these visualizations of the fetal heart tone patterns, and then eventually know what might be done about the fetal heart tone patterns. Okay, so if you would zoom in, and we're not going to, you would see that the average heart rate of this fetus is about 145. And remember, normal heart rate for a term fetus is 110 to 160. So this heart rate is normal. Let's take a look at the contractions. So with the contractions, there are 3 phases of a contraction. So it's the buildup, the peak, and the descent. Contractions are monitored for frequency, for duration, and also for intensity. So if you're timing how often the contractions happen, you're going to start right here from the beginning of one contraction to the beginning of the next contraction. And then you can say, oh, these contractions are happening every 3 minutes. And let's go on to the next slide. Okay, variability. The variability of fetal heart tones means fluctuations in the heart rate. Think about when you go throughout your day, your heart rate changes. It's lower when you sleep. It's going to increase when you work out and you go back to baseline. It'll increase when you get scared or mad and then go back to baseline. So it fluctuates through the day, and that's normal. And that's because of the sympathetic and parasympathetic systems working together. And it's the same for a term fetus. So moderate variability is what we call it, and that's considered normal in a term fetus because it shows that the fetus has a normal and functioning central nervous system. So some of the things that will interrupt variability are things like hypoxemia, maternal drug use, pre-existing neurologic problems. All of those things can result in the loss of fetal heart rate variability. So variability is the single most important thing to look at when you're looking at a strip, because it's the indicator of an adequately oxygenated fetus. So here's an example on the screen of moderate variability. So you can see the baseline heart rate right around here, and then you can see that there's some fluctuations. The technical definition is 6 to 25 beats per minute variation from the baseline. So that's what moderate variability looks like. Okay, so compare that with this slide. You can see this is the baby's heart rate, but you'll notice that it's not fluctuating hardly at all, and that's not good. And this is what we call minimal variability. Now, sometimes this can mean that the fetus is sleeping, so it's not always a bad thing, but if it's during labor and the minimal variability persists through all the contractions, all the stimulation, then we will have to consider that this fetus is under some distress. Okay, and this next slide shows marked variability. So over 25 beats per minute variability from the baseline, and marked variability can be caused by overstimulation of the fetus and also acute hypoxia. Okay, so we've talked about some of the basics with internal continuous electronic fetal heart monitoring. So in closing, I want to go back to the external versus internal monitoring. Why choose one or the other? If internal fetal heart monitoring is invasive, then what are the benefits? And I'm going to leave you with that question. I'm Dr. Ford, and you just completed a 6-minute intense brain workout on continuous electronic fetal heart monitoring, part 1.